Hello, I'm Lizzie. I'm one of the adult speech and language therapists in Oxford, and the short 3-minute video today is to give you some top tips for effective communication as well as recognising any swallowing problems. The reason I'm giving you these top tips is that as speech and language therapists we have a role in supporting people with speech, language, communication or eating and drinking difficulties. So today I'm going to give you 5 top tips. My first tip for effective communication is reduce distractions. The most important thing you can do is to try and create a quiet, calm and stress-free environment for communicating. So have a look around you in the environment. Can you turn down the television, turn off the radio, or do you need to close a window because there's outside noise? Reduce distractions. The second tip is give time. This is one of the most important ones, particularly for people who have a communication difficulty. They'll need extra time to respond. So try not to rush communication, give someone plenty of time and don't jump in with what you think they're going to say or pretend that you've understood when you haven't. Give time. Third tip is face the person. Only about 7% of the message that we communicate is actually through literal words. Most of it comes from how we say something, our tone of voice or our body language. So it's really important to be able to see somebody's face and read their facial expressions for effective communication. So make sure you can see the person. My next tip is, can you use any other means to communicate? So particularly when verbal communication can be difficult for someone, it's really helpful to think about other ways you can get the message across or supplement the verbal message. So can you draw something? Can you write down the words for someone? Can you show the actual object or a picture or a photograph? Or can you use gesture? These are all really helpful things, and you can ask the person if they've got a strategy that works for them. Finally, I've got a tip for you about recognising swallowing problems. So as I mentioned before, one of the roles for speech and language therapy is to support people with swallowing difficulties. So in terms of recognising if you or someone might have a swallowing problem, some of the symptoms or signs can be difficulty chewing food, drooling of saliva, people saying that they've got something stuck in their throat or they're having difficulty, or choking or coughing during eating or drinking, or a feeling that things are going down the wrong way. If you're concerned, speak to your GP or ask for a referral to speech and language therapy. That's all. Thanks for listening.